Evaluating a large number of persons to identify those with a particular set of characteristics is known as screening. Screening is a first step taken to decide on whether to defer the person for further proceedings or not. Screening can be done by observing the person directly through set checklist, talking to a family members, teachers, caretakers, peers. By conducting simple activities using playway techniques, we can identify persons with visual impairment and additional disabilities from a group. Screening is helpful in early identification of at-risk children. The aim of screening is to identify the number of people affected from suspected visual impairment with multiple disabilities. Identifying a person from a group of people which gives a clear understanding of the issues in identification. After identification, they are referred for further assessment or treatment to reduce the impact of impairment. Identification needs to be followed by a good quality intervention. This enables the children to learn adequate skills which in turn would enhance development. The professional need to understand the psychological and sociological implication of children with visual impairment with multiple disabilities. They should be more empathetic to the needs of individuals with visual impairment with multiple disabilities and address them appropriately in diverse educational settings. There are many eye conditions, each with different educational and social implications. The trainees will be able to develop the skills of doing functional vision and hearing assessment and enhance the residual senses through appropriate need-based interventions. Identification could be done by noticing any abnormality or deviance from normal appearance of eyes, facial features and unusual visual behaviors. Watery eyes, reddishness, swelling, discharge from the ears, squint, small or large eyeballs, small or large cornea, opaqueness of one or both the eyes, absence of eyeball, asymmetrical appearance of the face. Quizzing of eyes to look into object at distance, sensitive to bright light, bumps into materials or persons while moving in the low lit areas, taking reading materials and objects close to the eyes, tilting, lifting up and down the head while looking, frequent complaints of headache, irritation of eyes, constant rubbing of eyes, avoids tasks which requires visual skills. There are mainly two types of assessment, and that is clinical assessment and functional assessment. Clinical assessment are done by the doctors and experts in the field, whereas functional assessment are done by the special educators or interveners or professionals in the field of visual impairment with multiple disabilities. The assessment given here refers to functional assessment of children with visual impairment with multiple disability. Assessment is a continuous process and it should be done in the familiar environment or setup of the child. Assessment should help to identify strength as well as need of the child. Assessment should be carried out when the child is in active and in a cooperative mood. Assessment result will vary depending on several factors, including the child's health, alertness, bonding with the assessor, stimulation from the environment, materials used. It also depends on the confidence level of the assessor, because many of the professionals in the field do not have experience of working with children with visual impairment with multiple disabilities. Interdisciplinary team approach along with family professionals collaborations, we can get a high reliable results. The professional need to identify what he or she expecting to know about the particular child and should be ready with the key questions which will be helpful for gathering relevant information. Purpose of assessment gives us a clear picture of the child with visual impairment with multiple disabilities and his or her abilities in each area of functioning. After assessment, professionals are able to know the current functioning level of the particular child and thus in turn help the professional to plan intervention program and set long-term goals and short-term objectives to be achieved. In our country, when a parent is asked to tell about the child with the disabilities, they will immediately list out all the negatives that what the child cannot do by comparing the child of the same age group. They do not recognize the hidden abilities of the child or the current functioning level of their child. Assessment gives us the exact information regarding the abilities of the child, what and how well the child can perform the particular activity. Assessment also helps the professionals to decide on a placement of the child, whom the child likes to work with, best time to teach, likes and dislikes of the child. It also helps the professional to prepare teaching learning materials, decide on what works well with the child, make necessary adaptations and modifications in the environment, and provide appropriate aids and appliances for better and independent performance of the child with visual impairment with multiple disabilities. Georgia Sensory Assistive Project, assessment of students with visual impairments and multiple disabilities including deaf blindness, Texas School for Visual Impairment, Concertinum, 2016. Formal test yielding quantitative scores, IQ, mental age, percentile ranking or grade level. Interview or a checklist focusing on interactions with objects and people, most appropriate for infants, young children, results typical age range, stage of development. Rating scales and checklists look at basic life skills, self-care, social interaction, work skills, may give rating scores but qualitative description and environmental factors are. Frequency and intensity of behaviors analyzed to help design intervention plan. However, according to results of research study done by Roland, Chen, Marr and Steelman, 2009, traditional or formal testing of children who are deaf-blind or have multiple disabilities is not likely to give you much more information than confirmation that the child does not perform well on standardized test. We have to see the child as a whole and need to assess all the areas. We assess different functional areas like activities of daily living, that is ADL, it means toileting, bathing, dressing, eating, grooming, communication, both receptive and expressive, motor skills, that is it includes fine and gross motor, cognitive ability, social interactions, preferences, literacy. In literacy it includes reading, writing and arithmetic. Independent living skills. It includes pre-vocational and vocationals, orientation and mobility skills. It includes sighted guide and cane techniques. Sensory abilities, vision, hearing, touch, taste, smell, vestibular. Proper receptive and kinesthetic. Ecological assessment. It means the environment in which the child lives. Does he or she communicate intentionally to express her or his wants? Is his or her expressive behavior intentional directed toward a goal? How frequently does he or she communicate? What specific message does he or she express? Under what circumstances is he or she most communicative? Does he or she need prompting or support to communicate clearly or consistently? What type of communication does he or she understand? Who communicates effectively with he, her or him? Are there particular activities in which he or she is most likely to respond? He or she able to perceive speech, vocalization and environmental sounds? Would he or she benefit from hearing aids, amplification or noise reduction devices? In this area, the child is able to perceive, discriminate between and understand visually based symbols for a communication. What accommodations are needed to help her or him perceive visually based communication? Does he or she enjoy interacting with adults? When and in what condition? Does he or she enjoy interacting with peers? When and in what condition? Does he or she have the fine motor skills needed to use gestures or manual signs or active communication devices? What accommodations would allow access to communication system? What people thinks, activities does he or she prefer, dislikes? Where and when is he or she at her or is best? To what extent does the child tolerate direct assistance during activity? For an example, through hand over hand or through hand under hand technique. What is her or his temperament while providing direct assistance? Is the child existed, passive or quiet? Does he or she show sustained attention or lose interest quickly? Does he or she accept or reject challenges in routine, people and materials? There are many factors which will affect the process of assessing children with visual impairment with multiple disabilities. New environment, new persons, health issues, best time of the day, materials used for assessment, lack of trust and bonding between the assessor and the child, medicines taken for epilepsy or any other health issues, mood of the day, lack of time spent by the assessor, missing out subtle response given by the child, no specific mode of communication used and understood by the child, lack of experience of the assessor handling children with visual impairment with multiple disabilities. Globally, it has been recognized that the benefits of education is for national development, individual prosperity, health and social stability. These are well known, but for those benefits to accrue, children have to be included regardless to the special learning needs and degree of special needs in learning process incessantly. Till now, the efforts have been done to include children with the disabilities in the educational mainstream on national and international level. The initiatives have been increasing and showing positive approach. Inclusive education is a key policy objective for education of children and young people with disabilities. Inclusive education entails increasing the participation of students in and reducing their exclusion from culture, curricula and communities of local school. It has been worldwide realized fact that many of children with visual impairment with multiple disabilities are being hidden in the community because of the less awareness and belongs to poor family and less educated parents. Urban class parents take the initiations for early intervention and educational programs for their children. But again, availability of the human resources and research programs are very limited in this field, whereas few existing residential schools and other support services are mainly located in the urban centers. Partially due to this lack of access to education and partially due to lack of training facilities and job opportunities, only a minority of adults who are more disabled and living in developing countries have access to any kind of formal employment. The prevalence of multi-disability is increasing due to insufficient attention regarding the prevention of its causes and the survival of more severely disabled children. In most developing countries, neither have access to appropriate health, educational and rehabilitation services, nor to hearing and low vision devices. The existing personnel of the special schools for children and youth who are visually impaired, those for children and youth who have hearing impairment, and the special programs for those with children with visual impairment with multiple disabilities are not adequately prepared to address the educational and rehabilitation needs. Due to the lack of understanding of children with visual impairment with multiple disability, they are more vulnerable to abuse, neglect, abandonment and segregation in the community. Some international organizations are involved in supporting programs for VIMD, that is visual impairment with multiple disabilities, and a few postgraduate courses have also been introduced in some developing countries. As a result of the aforementioned facts, in most developing countries, there are even fewer programs and services to support the transition from school to work of the very small number of children with VIMD. There is a severe lack of interpreters and other individuals trained to communicate with VIMD and also interpret or translate for them with others who are not. UNESCO defines inclusive education as a process of addressing and responding to the diversity of needs of all learners through increasing participation in learning, cultures and communities and reducing exclusion within and from education. It involves changes and modification in content, approaches, structures and strategies with a common vision which covers all children of the appropriate age range and a conviction that is a responsibility of the state to educate all children. Inclusive education is not a marginal issue but is central to the achievement of high quality education for all learners and the development of more inclusive societies. For successfully educating all children, including those who have serious disadvantages and disabilities, a child-centered pedagogy is very important. The merit of such schools is not only that they are capable of providing quality education to all children. Their establishment is a crucial step in developing to change discriminatory attitude, in creating welcoming communities and in developing an inclusive society. A change in social perspective is imperative. Visual impairment children with multiple disabilities have impact on overall development. To have successful inclusion for diverse needs of children, multidisciplinary approach have shown greater effect than any other approach. The interdisciplinary approach blends more one discipline and creates team of professionals for the child that enrich the overall educational experiences. The interdisciplinary approach provides many benefits that develop into much needed lifelong learning skills that are essential to child's future learning. The multidisciplinary approach is a team thought, enhancement of child's performance, and integration of methodology and pedagogy and a much needed lifelong learning skills. A multidisciplinary approach involves drawing solutions based on development of child and assessment procedures appropriately from multiple disciplines to redefine problems and reach solution based on the new understanding of complex situation. Everyone plays own role and has own responsibility, consists of class teacher, special education teachers, educational psychologists, speech pathologist, audiologist, medical doctor, pediatrician, neurologist, child psychiatrist, physiotherapist, social worker and others. Planning. In an ideal inclusive classroom, the special education teacher and regular education teacher engage in co-planning. They work together to adapted curriculum and modification in the existing lesson to fit the needs of all the students, with the special education teacher focusing on the need of the special needs students. The amount of actual instruction a special education teacher gives in an inclusion classroom varies. In some inclusive classroom, the two teachers take turns presenting lessons. This may be done on a daily basis, with each teacher taking a portion of the lesson, or the special education teacher may teach the class 1 or 2 days a week when not teaching the entire class. The special education teacher may sit beside students and provide one-to-one help or additional instruction to help students feel more included as a part of the class. The special education teacher may not be in the inclusion classroom every day unless the students' need require it. Classroom should be adapted, modified and managed as per the need of the child with a disability. The classroom should be managed in such a way that the child with visual impairment with multiple disabilities does not face any difficulty in the process of learning. Children with visual impairment with multiple disabilities may also need to follow a need-based curriculum in the form of individualized educational plan, that is IEP. Teachers and educators must regularly review and develop individualized educational plans and hold meetings to discuss these plans with parents, administrators, counselors and other individuals involved in the education of the child with special needs. They must regularly administer skills tests and other assessments to determine the progress of special needs students. Importantly, a plan for curriculum adaptation, plan for conducting examinations for the children with VIMD, providing reasonable accommodation should be followed based on evaluation policy made under the National Curriculum Framework 2005. They should also make sure that the child with VIMD are not neglected from the taking part in the school activities including curricular, co-curricular, cultural and outings. The school should ensure barrier-free environment for all children with special needs. The child with VIMD should be able to access all departments of the school like library, auditorium, laboratory and toilets. Thank you.